What's up, YouTube? Welcome to my channel. It's Destiny. And today I'm going to talk a little bit about my career, which is a high-risk sonographer or maternal fetal medicine sonographer. And this is just to give you some insight. So I started this channel based off of motivation. So anyone who was interested in getting into the field, I want to shine a little light, give you the scoop, and let you know how we really get down. And before we get started, I just want to let you know the difference between ultrasound, sonogram. Is it the same thing? When you're coming in for your ultrasound or your sonogram, those terms can be used interchangeably. But us sonographers that are high-risk sonographers, we like to be referred to as sonographers, mainly because of the extensive training that we go through and the specialized field that we're in, maternal fetal medicine. So all of us high-risk or MFM physicians, physicians now, you're not a physician, ma'am. Our maternal fetal medicine sonographers, we have gone through extensive training. So we have taken our boards in physics. We are certified in obstetrics and gynecology, and we are also registered in fetal echocardiography. Put some respect on our names. All right, so let me give you a little background about me. So when I was in high school, I had no idea what I wanted to do, right? I had no clue. So I went to college for business management. I got my bachelor's degree in business management. And then I was working in a few different jobs, but mainly I was working in a health system where I did fundraising. And it was cool, you know. I just felt like I feel like I was missing something. Like, is this it? There has to be more. So I met really great people. I worked with really great people too, but I just was like, I don't know if this is it for me. Kind of, you know, getting dressed up, sitting in a cubicle. I thought I was about that life, but I wasn't really about that life. So one weekend I saw a commercial for ultrasound, and I was like, should I do it? And I did it. I was like, I'm just going to register for this. I'm just going to do what it do. So I ended up registering for school. And so the school I went to was Sanford Brown. Would not recommend. If you know, you know. The school's not open anymore. Let's just read between the lines. But anyway, that school offered a weekend program, and your girl had to work. I had a full-time job, okay? So I went to work Monday through Friday, full-time, Monday through Friday, okay? And then Saturday and Sunday, I went to school from 8 to 4 o'clock, I think it was. Yeah, 8 to 4 o'clock. So I did that for 2 years. It was a 2-year program. There were some prerequisites that you needed to have before you enter the program, but I had those because I had my degree already. So I just jumped right in there. So again, it was like a sacrifice. That's another thing I want to put out there, because I do like to talk about motivation. And if you want something, it's a lot of times they don't come easy. So for my sacrifice was, I'm pretty young. I'm talking about back then, not now. I was pretty young, and I was like, I'm about to sacrifice my weekends, like no days off. Is it worth it? But I wanted to change my career, so you got to do what you got to do. So I did end up going to school every weekend, and it was very interesting to me. This was my first time actually being in the medical, you know, doing anything like with patients, which was really interesting to me. In class, we were doing like general ultrasound. So general, for those of you who don't know, we're looking at your liver, we're looking at your gallbladder, we're looking at your kidneys. We were able to do that because there was like a lab that we went to, and so we all practiced on each other. And then there's also like vascular, where you can look at carotids and you can look at arteries and veins and things like that. And then there's obstetrics and gynecology, which is of course obstetrics, where you're looking at pregnant women, you know, you're looking at the babies, and gynecology has to do with the female genitalia, you know. So I liked general in school. So general in school, we're scanning each other and everything is easy. But let me tell you, when you go to your externship site, you go to a hospital setting, your girl wasn't ready. I was not ready for that. I was not ready for colostomy bags. Okay. I was not ready for tubes all over the place. I wasn't ready for patients that could not hold their breath. It was a whole new world for me. I was like, no, I don't want to do this. Ultrasound is a lot of different specialties, right? So I was like, I'm going to pass on that. I'm going to try to do as best I can. But I got to go. I can't do this. Find somebody else to do it. My next externship site that they placed me at was a perinatologist. So it was a maternal fetal medicine office where they did high risk ultrasounds. Oh my gosh. This is for me. Okay. This is what I want to do. This is what I like. So unlike general ultrasound, with high risk obstetric ultrasound, I fell in love with it. I loved it. I loved it so much. It was very challenging, but I loved it. I struggled. So I was very good at passing tests. I was very good at that. When it came to picking up the probe, that's what the little camera is called. It's called a probe or transducer. When it came to picking up the probe and finding the baby, I couldn't find a baby. where did the baby go? I would shadow the person who was teaching me, who was clearly, a professional sonographer. And then they would say, okay, Destiny, why don't you come in and you just, just do something quick, find a heartbeat. And I would be in there trying. I'm like, where did the baby go? Did she deliver? Where's the baby? Because it ain't in her uterus. But for me, it was super, super difficult because you're dealing with a moving target, number one, and various positions. So what you thought you learned, you're like, okay, I have this baby's head is down. So, okay, I know how to, that baby's head is down right now, but you blink and the baby's head is not down, or the baby move, or the mom needs to move. It was just so difficult for me. I was like, I can't do it. But I didn't let that get me down. I kept with it. I stayed with it. I tried to prove myself at my externship site. Like, they knew that I sucked doing the ultrasound, but I'm going to clean the room to the best of okay, it's going to be immaculate. Okay. This floor, not the floor. I was not cleaning the floor, but like I would clean up after them. I would make sure all the supplies were stocked. I would be there super early. I would stay there late if I needed to. I wanted to show them that I am serious. I suck at the actual job, but I'm here and I'm trying. So that is another thing. It was very tricky for me. And we get a lot of students throughout my career. We have a lot of different students, and some students come in and they just on their phone scrolling and they just don't care. But my advice to you is, if you suck at scanning like I used to, make sure you're compensating for that in some other way. You're there bright and early. You're willing to stay late. You're willing to help out. And you don't act like you already have the job, because that's how a lot of people act, like they're on the payroll. Ma'am, you don't even know how to scan yet. So doing high-risk sonography is very challenging. So I will say that we get a lot of people who say, oh my gosh, you must love your job. You take pictures of babies all day. Yes, okay, we do take pictures of babies all day. But again, you're working on a moving target. You're working on a mom that sometimes can't lay on her back, who needs to turn sometimes to lay on her side, who needs to stop and take breaks. You know what I mean? All of these factors come into play. It is very challenging. And then on top of that, very sick babies that you're going to scan. In this profession, you have to have your poker face, right? So if you see a problem, an anomaly, some type of pathology, you can't say anything to the patient. You get all the information that you need that is necessary for the doctor, and the doctor comes in the room after you're scanning and they give the information, all the results to the patient. So that is something to keep in mind if this is a career that you're thinking about getting into. You can't be in the room crying if you see an abnormality. You can't. You have to have thick skin and you have to put on that poker face. Some people don't have it. And if you don't have that, then this is not the profession for you. But some people just come for routine ultrasounds, and during that routine ultrasound, which they think they're just going to come and we just want to know what the gender is, or we want to have a gender reveal, or, we just want to see the baby's face, where it's really way more than that. And at those type of ultrasounds, we can see a problem, and again, those anatomy ultrasounds or 20-week ultrasounds are the ultrasounds where we're looking at baby from head to toe, making sure everything looks good. So again, it's just something to think about. It's not always good news. It's not always bad news, but it is a very challenging profession for sure. So if this is something you want to get into, just know that, because a lot of people think you're in there like a portrait studio. No, ma'am. One of the things that I truly do enjoy is that you do feel a sense of fulfillment in this job. There are patients that you see week to week because of whatever their condition may be, and it requires them to have weekly ultrasounds, and you end up creating a relationship with them where they kind of confide in you, and you're their sense of comfort. You're that face that they see every week. You will let them know that their baby is okay. They feel reassured by you. And there's so many people who thank us. There's so many people who come back with their babies after they're born. Like, you just feel a sense of fulfillment, and it makes you really enjoy your job. You're like, this is why I do it. So one of the other things that you do besides taking pictures are procedures. So some pregnant women do need procedures done. Those procedures are invasive, where you stick a needle a lot of times in mom's belly. There's all types of things. I've done fetal surgeries where you do twin-to-twin surgery in the OR. There's so many things that you can do in this field. So just know it's not just taking pictures of babies. All right, and that kind of just sums up. I wanted to give people an idea of what I do. It's so funny because I get some people, they're like, they're Black sonographers? Where'd you come from? I get that, like, I don't know. I feel like I'm not monthly, but every couple months I'll get someone who is just so surprised that we got all types of people. And the people that I work with are great. We have a little bit of everything, okay? Whatever your flavor is, we got it for you. We're all great. So yeah, that is the end of the video. I thought it was important to share because a lot of people are not aware of different type of professions that are out there. And since I am a sonographer for high risk, I felt like let me go ahead and let me shine some light on my profession. So if you're thinking about doing it, go for it. Just know it is not easy. It is challenging, but it is also fulfilling at the same time. So if you have any questions, leave them in the comment section down below. And thank you for watching. See you next time. Bye.